Hello, welcome to this episode of sexual and reproductive health. I don't want this video to be long, so I'll go straight to the point. In this episode, you'll be learning about vaginal discharge, right? And how do you differentiate between normal vaginal discharge and abnormal vaginal discharge? Using several parameters, using the color of the discharge, using the quantity of the discharge, using the texture of the vaginal discharge, and also using the odor, of the discharge, the smell of the discharge. Now, before I start, I would like to say that the vaginal discharge itself is a normal part of the vagina, and its main function is just to keep the vagina clean, to keep the vagina moist, and to protect it from infection, right? And also, depending on the cycle, which stage of this menstrual cycle, the discharge varies from being very thick or thin, be milky, so it depends on what stage, due to hormonal changes, the discharge, the color and texture of the discharge varies. So before ovulation, the discharge is little in quantity, it might be off milk or milky in color, but then during ovulation, it becomes clear in color, becomes stretchy and slippery. And of course, that is just because during ovulation, it needs to be stretchy and slippery in color to be able to assist the sperm to swim, for reproduction sake. But then after ovulation, it goes back to being milky in color, the quantity also being less. Now, also the odor is mild, so the normal vaginal discharge is a mild odor or no odor at all. But then, for the abnormal vaginal discharge, how you know that this vaginal discharge is abnormal is one, the quantity is mostly much. So when you take off your inner waist, you see a lot of it on your inner waist, you should know that something is wrong, right? It shouldn't be that much. Also, that the color might change. It might be grayish white. It might be greenish yellow. It might be greenish or yellow. So you just know that this color is different. It might be dark brown. So also from the color, you will get to know that it's abnormal. So the normal discharge should be either colorless or a little bit milky. When it becomes grayish or dark brown or bloody or greenish or yellowish, you know that there's a problem here. It's abnormal. Also, most of the discharge comes with pain. So there will be vaginal pain, or there will be itching, irritation, or burning sensation in the vagina. This is always associated with abnormal vaginal discharge, so that you know that, okay, now I'm having itching, I'm having irritation, that means this discharge is abnormal. And also, most of them are really foul smelling. Some of them smell like dead fish. If you are seeing, there's one bacterial vaginosis, forget about the medical terminologies, just know that it's really foul smelling. That's another way to know. So for the one that is tricky is the yeast infection. Now, because yeast is a fungi, it doesn't have smell. So you might think that, okay, because it doesn't have smell, it might be normal. No. How you differentiate the yeast from the normal is because the yeast the quantity is much. It's more like a cheese. You see, like cheese, like a cottage cheese is clumping in consistency. But then what differentiates the most is that it always comes with swelling and burning sensation in the vagina or the vulva. So that is where you know that, okay, this is abnormal. All right. So in gonorrhea, for instance, the discharge is yellowish or greenish with foul smelling, with pain. In pelvic inflammatory disease, you see yellowish or greenish with pain. So it always comes with either pain, or the color will be yellowish or greenish. Might be either burning sensation, really foul smelling. This is the way to know that this discharge is abnormal. Now, how do you prevent this? Which is very important. First of all, some women are actually the cause of them having vaginal infection, because some of them wash their vagina as if they are doing a laundry. You don't need to use soap and to wash the vagina, because there's a bacteria that's normal in the vagina. That is the lactobacilli. Its function is to produce acid in the vagina, right? Now, this acid that is in the vagina is responsible for making sure that the environment is acidic, so that acidic environment kills other bacteria that are infectious. So when you wash with soap, you wash away the acid, Simply put, now you wash away the acid, and then the other bacteria that are still, the other bacteria in the vagina that are actually infectious now begins to thrive, and that is what causes the infection that we see and all those abnormal vaginal discharge. So do not use soap in the vagina. Just warm water and allow the vagina to self-clean itself, right? That's one. Then for those who are sexually active or have multiple sexual partners, it's always advisable to use a condom, right? Just to prevent vaginal infection. Also, when you're selecting your inner wears, make sure you select those that are made of cotton, and also they should not be too tight, right? Because when they're made of cotton, when they are made of nylon, for instance, and they are tight, they just accumulate moisture in the vagina, and that could be prone to infection, right? So also it's good to always go for investigation, just for screening, to be sure that all is well. I just hope that you've learned something about how to differentiate between the normal and the abnormal vaginal discharge, and immediately you get to see that you have abnormal vaginal discharge, kindly go to the hospital. You get tested, properly screened, and properly treated. And when they give you antibiotics, make sure you complete the dosage, because that's another problem. Most women, once they take for the first, second, third day and they're OJ, they do not complete their medication, and then that will cause a reoccurrence and probably antibiotic resistance. I would not want that. So you notice abnormal discharge, go to the hospital, get screened, complete your medication, and you'll be fine. I'll see you in my next episode on sexual and reproductive health. Stay good. Have a good day.